My name is Chelsea Pascal, and this will be my complete head-to-toe assessment. All right. Can I have you state your name and your date of birth, please?
Jessica Dubigan, 1/14/90.
Perfect. You know what year it is now, Jessica?
2019.
You know who the president is?
Trump.
And you know what kind of place we're in?
House.
Perfect. So as you can see, she's completely alert and oriented. We'll move on. I'm going to assess your head and neck and everything else, okay? So I'm first going to assess your head for symmetry, make sure there's no abrasions or tenderness around your head. Everything looks symmetric. You have no pain or anything going on in your head. Okay, so as I look at your face, it looks symmetric to me. Can I have you raise your eyebrows and smile? Good, and frown and scrunch your nose. Perfect. As I do that, I'm going to take a look at your eyes. I'm going to first look at your optic nerve. So let me take my scope here, right hand, right eye, look straight ahead. Perfect. I can see the optic fundus. Everything looks intact. I don't see anything going on there. Left hand, left eye, straight ahead. Great. Everything looks great with the optic fundus there. The next thing I'm going to do is I'm going to test your cranial nerves. So I'm going to have you look at my finger. I'm going to come in, I'm going to come out. Follow my finger. This is testing cranial nerves 3, 4, and 6. Great, her eye movements are intact. I don't see any extra eye movements at all. I'm going to take my pen light here. I'm going to have you look directly at me as I shine this light in. I'm just making sure your pupillary reflex is intact. Great. I'm going to go across the same thing. Just look at me. Good. Okay, everything seems to be intact there. She has complete perla, so everything is intact. It accommodates. The light reflex is there. So her eyes look great. They are symmetric still. This whole time I'm also taking a look at her skin, making sure it's intact, that it's warm, there's no lesions, there's no bumps, or bruising or anything like that along the lines as we go along. So moving down, I'm going to look at your nose. Here it looks symmetric to me. I'm going to test for patency. Are you able to close one nostril and breathe in? Good. And the other side? Good. So both sides is patent. I don't see a deviated septum. I'm going to go over here, take my scope, and we're going to look inside each nostril. Good. All right, everything looks clear this way. Everything looks clear this way. All right, nose is clear. Moving on, I'm going to look at her mouth. Right now her lips are moist. They're not dry and cracked. So I'm going to have her open up wide. I'll take a look on the inside, inspect. Everything looks moist and pink. I see no deviation in her tongue. Can you stick your tongue straight out? Can you move it from side to side? Perfect. There's no deviation there. What I'm going to do is take a tongue depressor and my pen light. I'm going to check back here. Can you take your tongue out? I'm going to push down and have you say, ah. Perfect. I don't see any deviation. Everything is intact. That also tests for cranial nerves 9 and 10 by you saying, ah. Everything is moist there. I'm going to feel right here. I'm going to have you open and shut your jaw. Same thing. Great. She has great jaw strength. We don't want anyone biting us, so that is a good way to test strength. The next thing we do is look at your ears. From the front, they look symmetric. Do you have any pain in your ears? No? Okay. So I'm going to go ahead and take a look on the inside. What I'm going to do first is pull up and pull back. And we're going to go look in the side. Great. The tympanic membrane is intact on that side. Let's take a look on this one. All right. Tympanic membrane is intact over here as well. We're going to do a little hearing test. I'm going to say some letters and numbers into your ear. I just ask that you repeat them back to me.
1BA. 2C3.
All right, so her hearing is intact according to the whisper test, which is also cranial nerve 8, the acoustic nerve. What else I could do is do a Weber and a Rhine test with a tuning fork, even though it's not So what I'm going to do is tap the fork, put it on the top. Does it sound even?
Mm-hmm.
When you can't hear it anymore.
No.
So now we're going to, that was the Weber one, we're going to do the rind. So we're going to go on the back. Can you hear?
No. Yep.
Same on both sides?
Same.
All right, everything is equal up there. The next thing I'm going to do is I'm going to look at your trachea. Make sure it is symmetric and midline, which it is. Palpate both sides. I'm going to have you take a sip of water. As you swallow, I'll make sure we're still midline. Yep, everything looks midline. Any pain?
Mm-mm.
All right, so I'm going to come around to the back. I'm going to feel the trachea as well. Make sure that I cannot feel the thyroid. And I cannot, which is a normal finding. Okay, and we will move on. We'll do some lymph nodes. I'm going to make sure there's no pain or swelling of your lymph nodes. Just let me know if they're tender at any point. Go down to your clavicular lymph nodes. Any pain or tenderness there?
Mm-mm.
All right, and I didn't feel any nodules, any swollen lymph nodes, so everything seems to be intact with your lymphatic symptom. All right, so moving on, let's do some range of motion. I'm going to have you touch your chin to your chest. Fantastic. And lift high to the ceiling. Perfect. Over to the left side, over to the right side. Awesome. I'm going to have you touch your ear to your shoulder without moving your shoulder. Same thing. Great. I'm going to have you do the same thing. Push against my hand. Against my hand. Good. So everything is intact there, which is great. She has great range of motion in her head, and you didn't have any pain when you were doing any of that. All right. Her skin feels warm as of right now on her face and her neck. We're going to move on to her shoulder joints. I'm going to feel throughout here. Any pain or tenderness in your shoulders?
Mm-mm.
All right. So I'm going to have you shrug your shoulders. Good. Now I'm going to push down. I'm going to have you do the same thing. Great. All right. So that tests cranial nerve 11. Can you say light, tight, dynamite?
Light, tight, dynamite.
That tests cranial nerve 12. And her speech is clear and it is distinct. So moving on from the shoulders, I'm going to have you, as you're sitting, I'm going to have you raise your arms up, forward in front of you, and back down. Now out to the side, down. I'm going to have you go all the way up, touch your palms, and come back down. Great, and you can rest your hands back in front of you. The next thing I'm going to do, you didn't have any pain or anything there.
Mm-mm.
All right, so I'm going to hold your shoulder, and I want you to do the same thing on this arm. So go up and down. Good, now lift your arm to the front and side, and all the way up as much as you can. Great, I don't feel any crepitus in there, which is good. Same thing on this one. Front, side, and try to go all the way up. Great. So I don't feel any crepitus there. Those joints feel okay. The next thing we're going to do is move on to your elbow joints. So I'm going to take your elbow, and I'm going to have you try to pull towards your face. Great. Now push down against my hand. Great. You have no pain in that arm?
Mm-mm.
Same thing. Pull towards you and push away. Great. Any pain in that one?
No.
And can you do that yourself? Straight arms, bend your elbows. Good. Can you turn your wrists forward, backwards? Great. I'm going to have you take your wrists, hold them up, palms up, now palms down. Have you spread your fingers, make a fist, push them together the other way. Great. And any pain or swelling in your wrists?
No.
So while we're here, I'm going to feel your brachial pulse. Good. It's a 2+. We rate it on a scale of 0 to 4. Radial pulse in this arm feels good. I'm going to make sure it's even on this side. And it is. So we have good radial pulses. Feel for the brachial. So we have 2+ all the way through both arms in the pulses. I'm going to go up to your head and I'm going to feel for your carotid arteries, okay? I'm going to feel 10 seconds on each side. Good. I get a good pulse out of the carotid. It is even. It is regular. I'm going to listen for a brewy, with the bell of my stethoscope. I do not hear any breweries at all for that. And the next thing we are going to do is listen to your heart. So what I'm going to do is listen to each aspect of your heart. We're going to start up on this side. We're going to listen to the aortic, the pulmonic, Erb's point, the tricuspid, and the mitral. We're going to listen to all 5 of those. I'm first going to listen with my diaphragm, and then I'm going to listen with the bell of my stethoscope, listening for regularity and any extra heart sounds that there are. All right, her heartbeat is regular, and I hear S1 and S2. I do not hear any murmurs, any clicks, or any extra heart sounds. I'm going to feel for the apical impulse, which is normally between your mid-sternal and your mid-clavicular line, about the 4th or 5th intercostal space, so it should be right about here. And I do feel a regular apical impulse. So as I'm doing that, I'm assessing her chest motion. Everything looks symmetrical. She's breathing in and out at a normal pace. She doesn't use her accessory muscles in order to take a deep breath. So next thing I'm going to do is listen to the lungs on the anterior side of her chest. I'm going to move in a ladder motion. Just breathe regularly. Alright, so from the front, her lungs sound clear. I do not hear any adventitious lung sounds. I do not hear wheezes, crackles, or anything of the sort in the anterior part of her lungs. So what I'm going to do now is have her lay on her left side so that I can hear for any extra heart sounds as well. Perfect. This will push the heart to the front so I can listen with the bell in my stethoscope. I do not hear any extra heart sounds. I just hear S1 and S2. I'm going to have her lay flat on her back while she's laying down. We are going to look at the skin of her abdomen. So we'll start here. We're going to look at the abdomen first. As I'm inspecting it, it looks symmetrical. I do not see any obese or any protrusions or masses or anything coming out of her abdomen. As I come down here, get eye level with her stomach, is symmetric. I don't see any bulging. I do not see anything asymmetrical here. So the next thing I'm going to do is listen to her bowel sounds. I'm also going to listen for the vascular system as well, make sure I don't hear any breweries or anything else in her abdomen. Okay, so as I listen to her abdomen, she does have bowel sounds that are present. You're listening for about 5 to 30 within a minute period. If I did not hear any bowel sounds, I would have to listen to each quadrant for no less than 5 minutes to officially say they were absent, but in this case, it's a normal finding. She has present bowel sounds. The next thing I'm going to do is percuss in each quadrant. Make sure there's no pain going on. There's no pain in your abdomen. Make sure there's no pain, and I can percuss the base of the liver as well as the base of the spleen. Okay, so percussing the abdomen, I do hear tympany, which is a normal finding. That's due to the air that comes to the surface. In both the base of the liver and the base of the spleen, I hear the dullness, which is a change, but a normal finding as well. So now that I have inspected, I have auscultated, and I have percussed, the next motion would be to palpate the abdomen. I'm palpating for any masses, any irregularities in the abdomen as well. So we're going to go across each side. Tell me if you feel any pain or tenderness at all. This is just a light palpation across the abdomen. Any pain? All right. I did not feel any mass. I did not feel any asymmetrical abnormalities of her abdomen. So her abdomen is intact and symmetric. The next thing I'm going to do is percuss for the spleen. So I'm going to take my hand. I'm going to put it all the way underneath her back, lift up just slightly. I'm going to point my fingers at the axilla, and I'm going to push down for a heavy palpation. All right. So the spleen is intact. If it was enlarged, I'd be able to feel it at the bottom, but since I do not, her spleen is in good condition. I'm going to do the same thing over here. I'm going to put my hand underneath, lift up slightly, and push down for the base of the liver. Any pain when I do this? Okay. All right. Liver is intact. Spleen is intact. Abdomen looks good. While she's laying down, I'm going to do range of motion for her hip joints. What I'm going to ask you to do is lift your leg up. Yep. Good. And back down. Same thing with the other one. Good. And can you lift this one straight up, straight down, straight up, and straight down? Great. Can you lift this one back, knee to chest? And can you turn out and back in? Good. And then the same thing on the other side, out and back in. Any problems with your hips when you do that? Any joint problems, pain, tenderness? Okay. She has full range of motion, and her hips feel intact. I don't feel any masses. I don't feel any asymmetrical abnormalities. The next thing we're going to do is I'm going to have her sit up, and I'm going to move to the back so I can listen to the lungs in the back. Before I do that, I'm going to test for tactile firmitis. So as I put my hand on your back, I want you to say the word 99.
99, 99, 99, 99, 99, 99, 99, 99.
All right. So that is good. That is intact. I hear great vibration, or feel great vibrations. So we're going to listen. So every time I put my stethoscope there, I'm just going to ask you to take a deep breath. All right, her lungs sound clear in the back. I moved in a ladder motion all the way down her back to her lung bases. Everything sounds clear. I do not hear any crackles. I do not hear any rails or wheezes going on, any extra lung sounds, advantageous lung sounds at all. While I'm back here, I take a peek at her skin. Her skin is completely intact. I do not see any abnormalities, any lesions, any moles, anything like that on her back. Her spine is directly straight. There's no curvature or lordosis or kyphosis or scoliosis as she's sitting down right now. The next thing I'm going to do while she's sitting up, I have her scoot back a little bit on the couch. We're going to test the joints in the knees, which at this moment there doesn't appear to be any edema. Is there any pain or anything in your knees?
Mm-mm.
All right, can you straighten out this leg? Good. And straighten this one. Great. And there's no pain when you do that as well? All right, so I'm going to work on your ankles and your toes. Can you point your toes and flex your toe? Good. And can you turn your foot out and in? Good. And we'll do the same thing on the other foot. Point and flex, twist out and in. Great. Any pain?
Nope.
All right, so as I can see, there is no swelling. There's no pain. There's no tenderness. There's no redness. Her joints are intact. Knees, ankles, toes. The next thing we are going to do is I'm going to test your reflexes. So we'll start up here with your bicep reflex. Rest your bicep in mind, forearm in mind. Ready? Great. This one. Awesome. And your tricep reflex. So I'm just going to have you have your arm go dead. Good. Arm dead. Great. We'll do the same thing with your knees. Good. And same thing with your Achilles. Good. Flex against that. Good. All right. The next thing we're going to test is your plantar reflex. Okay? So I'm going to take the end of my reflex hammer. We're going to go up and make a J. And we're going to go up and make a J. Good. There's no Babinski reflex there, so that means you did a great job. Everything's intact. I'm going to have you stand up. Great. I'm going to have you walk back and forth. Good. As you can tell, her gait is intact. She is steady. I'm going to have you face me, stand with your feet together. We're going to do a Romberg test, so I'm going to have you stand with your eyes closed for 20 seconds. Good. And there's no swaying. There's no movement. You can open your eyes. Everything looks great in that realm. You can go ahead and sit back down. We're going to test your sense of touch at this moment. I'm going to have you close your eyes. I'm going to touch over your body. You tell me if it's sharp or dull.
Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp.
All right, so skin is intact for that sense of touch. And we're going to use a light touch. So when I'm going to touch you with this, and you just tell me when you feel it.
Now. 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 Now.
All right. Sense of touch to light touch is intact. I'm going to have you hold out your right hand with your eyes closed. I'm going to put an object in your hand. I'm going to have you feel around. And can you tell me what that object is?
The key.
Perfect. And I'm going to do the same thing with your other hand.
The coin.
Perfect. She did great there. And the next thing I'm going to do is use my tuning fork. We're going to go over each bony prompt. You tell me when you feel the vibration start and when it ends.
Okay. Now. 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 Now.
Perfect. So that is all intact. And that concludes our head to toe assessment. Thank you very much.